Capillary blood glucose level monitoring. BGL or blood glucose level refers to the concentration of glucose in a person's blood, which is a key indicator of how well the body is managing blood sugar. It is measured in millimoles per liter or milligrams per deciliter. The target range for adult is 5 to 12 millimoles per liter. Monitoring BGL can vary depending on patient management. For patients who are treated with subcutaneous insulin, monitor glucose level at least once a day. If levels are unstable, test 3 to 4 times a day until stable for 2 days. Patients treated with oral agents, if levels are unstable, test 2 times a day until stable for 2 days. Then test before breakfast for 3 days. Then test every 2 days. Patients treated with diet, if levels are unstable, test 2 times a day until stable. Then test every 3 days prior to breakfast and 2 hours after breakfast. If you are unsure how often you should monitor patients' BGL, always ask for clinical guidance with senior clinician and specialist. Make use of your clinical judgment and consider patient individual needs. Equipment for testing BGL. Glucometer. Before using, ensure meter is intact and well charged. Testing strips. There are 2 types. Blue for testing glucose and purple for testing ketones. Quality control solutions. Blue cap for high solution, and white cap for low solution. Ensure both are in date as machine may prompt you to perform quality control before testing. Lancet, must be in date. This a one-time use only. Additional equipment essential to this procedure are gauze pieces and sharp spin. Doing a quality control or QC for all glucometer is essential to ensure accurate blood glucose reading. QC for glucose is done once a day, weekly for ketones. Here is how. First, scan UID. Next is to scan the low solution, then the strip required for QC. Insert strip into the meter and avoid touching the transducer end of the strip. Apply a drop of the low solution into the reactive spot of the strip, and wait for the result. Remove the strip and repeat the same process, this time using the high solution. Important considerations before the point of testing. Ensure that you have the correct patient, you are aware of the history of diagnosis and patient's BGL trend. Additionally, factors like medications, eating or drinking and being unwell or undergoing surgery impacts the reading. Capillary blood glucose, point of care testing. Scan your ID first. Then proceed to scan patient's ID wristband. Check if you have the correct patient details. Scan glucose testing strip barcode. And then, choose option 1, which is capillary. Insert the testing strip into the meter, avoid touching the transducer or the reactive side of the strip. At this point, you must wear appropriate PPE and patient's hand must have been washed with soap and water. Do not use alcohol wipes to clean patient's finger. Gently massage finger to encourage a blood flow. Prick the side of your fingertip with the lancet. Avoid pricking the finger pad or tip. Apply a drop of blood into the reactive spot of the strip. The meter will indicate when enough blood has been collected. Wait for the result and inform the patient. Make sure to discard used equipment into appropriate bins and do aftercare. Document the capillary blood glucose reading. Ensure correct patient details are written on the document. Real-time entry of date and time of test reading. Legibly write the result and plot into the graph. Aim target range for a normal BGL is 5 to 12 millimoles per liter. If reading is less than 4, escalate to the medical team and seek urgent review for hypoglycemia. This is a condition where blood glucose is low. If reading is more than 14 in the last 3 hours, escalate to the medical team and seek urgent review for hyperglycemia. This is a condition where concentration of glucose in the blood is high. If BGL test reading is more than 27.7 millimoles per liter, you must retest. Before doing so, ensure patient's hand is cleaned appropriately. If the retest result is still 27.7, escalate to medical team immediately. Clinicians may ask you to test for capillary ketones and do a venous blood gas. Ketone testing helps identify a dangerous complication of diabetes called diabetic ketoacidosis or DKA. Ketone levels and what action to take. Below 0.6, normal reading. 0.6 to 2.9, alert medical team of the reading and monitor patient ketones hourly. Ketones above 3, seek urgent medical attention as patient is high risk for DKA and monitor both glucose and ketones hourly. For some patient, ketones need to be checked if they have conditions like type 1 diabetes, had total pancreatectomy, pancreatitis and their BGL is above 14. Patients who have type 2 diabetes, check their ketones if BGL reading is more than 20. Anyone on SGLT2 inhibitor, check ketones daily. Pregnant women, check ketones if BGL reading is more than 10. Patient empowerment is an important factor in giving patients greater control over their health. Their understanding on how to interpret their BGL readings, correct testing technique, personalized treatment plan with access to equipment and supplies, communication and support can lead to improved health outcomes.